Hello, my name is Louise Baldwin and this is my presentation on human immunity. In this presentation we will be looking at non-specific defences against disease, specific immunity and the biology of vaccination. Human immunity means having the ability to prevent the invasion of harmful pathogens. Infection is characterised by the introduction of foreign microorganisms, also known as pathogens, such as viruses, bacteria, fungi and parasites into the body that are not typically found there. Since not all infections have symptoms, diagnosing them is not always simple. When bacteria or viruses enter the body through the mouth, nose or open wounds, it results in an infection. Singular-celled organisms called bacteria are known to cause diseases including pneumonia and meningitis. Unlike bacteria, viruses require a host to multiply and thrive. Chickenpox and ordinary colds are a result of viruses, whereas fungal diseases result in things such as athlete's foot and ringworm. Lastly, parasitic diseases are caused by parasites and can result in things such as scabies and malaria. There are several different ways in which infection spreads. We will be looking at the four most common: indirect contact, direct contact, insect bites, and food contamination. When a germ or virus is transferred to a surface that someone else touches, it then absorbs into their body, usually through their mouth. This is known as indirect infection spreading. A cold virus is believed to be able to live on indoor surfaces for a few days, but over time its capacity to spread infection quickly declines. Most infectious diseases are contracted through direct contact with an infected person or animal. This can happen through kissing or other direct contact, or it can happen when an uninfected person comes into contact with animal waste. It can also be passed from a mother to her unborn child through the umbilical cord. Additionally, infectious diseases can be spread via insect bites through vectors. This is how insects like ticks and mosquitoes typically spread disease. A healthy individual can become infected with disease-causing bacteria by consuming tainted food or water. Food can get contaminated with bacteria like E. coli, which can lead to food poisoning and extremely sickening symptoms. To guard against infections, the body uses three defensive mechanisms. Particular defences apply to the first two lines of defence. Non-specific defences are mechanisms that keep infections out of the body or serve to get rid of intruders. Genetically coded, these defences operate on their own initiative. First is the skin, the largest organ in the body. The skin serves as a barrier between internal organs, functions and infections. As long as the skin remains unbroken, it is a barrier to preventing infection. It serves as the body's first line of defence against infectious diseases, as well as preventing infections from entering the body by defending against external barriers. If the skin is grazed or cut, it can mend itself by creating a scab fast, which serves as a temporary barrier until the underlying skin heals. Innate defences also include the existence of normal flora and salty skin, as these characteristics prevent germs from growing in the correct conditions. There are three skin layers: the epidermis, the dermis, and the subcutaneous layer. Second is the mucous membrane, which are another first line of defence. The surface of our gastrointestinal, respiratory and urogenital tract are lined with mucous membranes. Enzymes from internal mucous membrane secretions are another tool the body uses to combat germs. These membranes are in charge of keeping nutrients from passing through while screening out bacteria and infectious agents. These serve as the main point of contact between the human body's original environment and the outside world. The nasal cavity is the respiratory system's first line of protection. The nasal cavity assists in keeping undesired pathogens out of our body by filtering them out because our breathing is unable to distinguish between different germs. In females, the area prone to infection is the urinary tract. The female urethra is small and can allow foreign bacteria such as E. coli to enter the bladder, making it one of the areas of the urinary tract most susceptible to infection in females, even with strong protective barriers. But for both sexes, the majority of bacteria will be eliminated as the bladder empties. The body responds to damage or infection by initiating an inflammatory response, which is the innate immune system's reaction involving several cellular processes. The physical impact includes blood vessel dilation that creates openings in the cell wall for big blood cells to pass through, boosting blood flow and inducing inflammation. Because of the excess blood and proteins drawn to the infection, the area may seem enlarged, feel warm to the touch, and frequently hurt due to inflammation. One of our second lines of defence, inflammation is essential because it isolates the area, preventing damage from spreading and fostering healing. with inflammation, which has a vital part in the body's ability to mend. When more blood flows to the injured location, the number of white blood cells increases. Any sudden increase in blood pressure can cause a fever. This aids in the rise in the white blood cell count. Phagocytes are big white blood cells that engulf or swallow foreign objects to shield the body from harm. The bacteria, for example, that has been engulfed is broken down by enzymes with the phagocyte. This process is called phagocytosis. The lysosome and the phagocytosome combine to form a phagolyosome. The digestive enzymes within the phagolyosome break down the contents, stopping the phagocytosis process. The immune system depends heavily on the macrophages, which are produced from monocytes during inflammation. A kind of cytokine cell called a macrophage eliminates pathogens to shield the body against microbial infection. The immunological response serves as the last and third line of protection. Microbes or pathogens, which can be bacteria, viruses, or fungi, cause the immune system to react. An antigen is an invasive pathogen or microorganism. The immune system views it as a threat and has the power to trigger an immunological reaction. Proteins known as antigens are present on the surface of pathogens. The immune system creates antibodies that are Y-shaped structures to fight against foreign substances that enter the body. A specific type of white blood cell known as a lymphocyte identifies the agent as foreign and generates antibodies against it. Every antibody has a distinct binding site shape that hooks onto the particular antigen form. The pathogen or antigen is destroyed by the antibodies and taken up by macrophages for digestion. The immune response fades as the invasive microorganisms are eliminated. A person who has experienced an illness typically doesn't contract it again because memory cells unique to that antigen are produced by the body. The bacterium that caused the illness is remembered by the memory cells. Adaptive or specific immunity that has been acquired does not exist from birth. It is acquired over time. When an individual's immune system comes into contact with foreign invaders, such as an infection or disease, it detects antigens. The learning process will then begin. The elements of acquired immunity start to form a memory of each antigen and learn how to combat it with most effectively. Because acquired immunity adjusts to its attack to a particular antigen that has already been seen, it is also known as specific immunity. Its capacity for memory, adaptation, and learning are its defining traits. Leukocytes, another name for white blood cells, are the immune system's first line of defense against infection. There are many variations and each has a distinct function. White blood cells, which make up 1% of the total blood in the body, are created in the bone marrow. Some are innate, while others are a byproduct of developed immune system. There are 5 distinct types of white blood cells that exist. They each play different roles and offer particular immunity, which can be seen on the diagram on the screen. B-cell maturation takes place in the bone marrow, where it can result in the production of plasma or memory cells. These cells aid in T-cell alertness and immunological memory. When a pathogen is encountered, plasma cells release antibodies into the bloodstream to fight it. Memory cells visit the lymph nodes, retain information about the antigen, and when triggered can establish a defensive mechanism rapidly against additional exposures. We can see this process on the screen. The body is protected against illness and infection by 5 different types of antibodies that are produced by the immune system. Though the detection and destruction of bacteria, viruses, and other disease-causing microbes, they contribute to the fight against disease. Because they have unique chemicals on the surface called antigens, harmful pathogenic organisms are recognized as intruders. Every antibody your immune system produces attaches itself to a particular antigen and either eliminates the pathogen or labels it so the other immune cells can identify it. Here we can see in the diagram the 5 different antibodies and their functions. The immune system's capacity to distinguish between its own self cells and foreign non-self substances is known as self-tolerance. When unfamiliar chemicals are present, it mounts an immune response, combats the disease, and expels the invaders from the body. MHC1 and MHC2, also known as major histocompatibility complexes, are essential to this process. These are groups of proteins on the cell surface that function mainly as receptors for foreign antigens produced by invasive infections. B cells, dendritic cells, and macrophages are examples of antigen-presenting cells that contain MCH2. When T cells detect antigen fragments provided by MCH2, they will assault any cells expressing these antigens. All nucleated cells have MCH1 as a self-identity mark on their surface, protecting them from immune system assault. To elicit a prompt response to non-self antigens, they primarily engage with cytotoxic T cells. When an individual's immune system responds inappropriately to an antigen that it has already encountered, the condition is known as hypersensitivity. There are 4 categories in which hypersensitivity is classed. We can see these on the screen. While a functioning immune system guards against sickness and diseases, autoimmune illness causes the body's defences to mistakenly target healthy cells, impairing physiological function and occasionally being harmful. Though the exact causes are unknown, women are more frequently affected by autoimmune disease and considerably more likely to develop others after receiving a diagnosis. I will be looking at 2 different autoimmune diseases, the first being rheumatoid arthritis. Rheumatoid arthritis usually affects the hands, knees and ankles symmetrically. It is caused by the immune system attacking the synovium tissue lining joints. Joints that are heated to the touch and swollen due to synovial inflammation. Usually stiffness lasts longer than 30 minutes in the morning when it is at its worst. Rheumatoid arthritis symptoms can vary, but during a flare-up, extreme inflammation is usually coupled with accompanying symptoms including exhaustion, fever and appetite loss. Genetics, physical strain and infections are all considered potential factors. There is currently no known cure, but with the right diagnosis, symptoms can be controlled with medication and physical therapy to enhance function and general wellness. The second autoimmune disease I will be looking at is type 1 diabetes. Type 1 diabetes falls under the type 4 hypersensitivity category. It is characterized by elevated blood sugar and immune system attack on the cells that make insulin. The pancreas, a gland located behind the stomach, produces the hormone insulin, which regulates blood sugar levels. Insulin travels from the bloodstream into the cells when food is digested and enters the bloodstream where it is metabolized to provide energy. On the other hand, glucose cannot be converted by your body into energy if you have diabetes. This occurs because either insufficient insulin is created to transfer glucose or the insulin that is produced is not functioning effectively. You cannot modify your lifestyle to reduce your chance of type 1 diabetes. Prolonged thirst, frequent urination, fatigue, hazy eyesight and abrupt weight loss are just a few signs. In the UK, 8% of the population have type 1 diabetes. The process of transferring cells, tissue or organs between a donor and a recipient is known as transplantation. A donor's healthy organ or tissue might be used to replace a failing organ system or one that has been damaged due to illness or trauma. But when transplanting organs or tissues from one person to another, the immune system presents a significant barrier to successful organ transplantation. The transplanted organ or tissue will eventually be destroyed as a result of the immune system mistaking the transplant for something foreign, which leads to rejection. By modifying the immune system to lower the likelihood of rejection, the transplant's long-term survival can be preserved. To reduce the chance of rejection, the donor and recipient are thoroughly blood matched before transplantation. Immunosuppressive medications work by reducing the immune system's overall reaction, which helps to both prevent and treat transplant rejection. Nevertheless, immunosuppressive medications are non-specific, increasing a patient to illness and have a long list of undesirable side effects. Clinical rejection occurs in 3 stages: hyperacute, acute, and chronic. Over the course of a lifetime, acquired immunity is divided into active and passive categories. It is possible to develop both types of immunity artificially or naturally. Instead of relying on memory cells, passive immunity uses antibodies from the outside world to give quick, temporary protection that lasts for a few weeks or months. It develops spontaneously from person to person. Immunity transferred from a mother to her child through the placenta or breast milk is one example. This is helpful in situations where the infection is possible and the body is unable to swiftly develop antibodies for immunological response. In immunocompromised patients, such as transplant patients, it can be artificially obtained through the antibody injection or transfusion, which is an advantage when the body lacks time to produce its own immune response. When an infectious agent or antigen is directly contracted, the body's immune system responds automatically by creating memory B cells, which retain the memory of the pathogen and may quickly mount an immune response upon re-exposure. This process results in the development of active immunity. The outcome lasts for a long time, sometimes a lifetime, even though the response is delayed. A vaccination can purposely induce active immunity, or it might develop spontaneously in response to an infection or a virus such as chickenpox or a cold. To enable the immune system to create immunological memory that will protect the body going forward, vaccinations purposely expose a person to a small quantity of the pathogen. This is beneficial since it keeps a person from being exposed to illness and virus that are already active and sometimes lethal. A simple, safe and effective way to protect yourself from infectious diseases before you develop them is to be vaccinated. It strengthens your immune system and builds resistance to particular infections using your body's defences. Vaccines teach your immune system to produce antibodies in the same way that it does in the event of an illness exposure. Vaccines, however, do not cause the disease or increase your risk of its complications because they only include weakened or dead versions of bacteria or viruses. We run the risk of developing major illnesses and disabilities from diseases like measles, meningitis and polio, for example, if we don't receive vaccinations. A lot of these illnesses have the potential to be fatal. Immunological memory is created without the presence of disease-related symptoms when vaccinations initiate a basic immune response that produces memory B and T cells. The initial reaction to a pathogen infection is known as the primary response. To locate the appropriate antibody to combat the disease, B cells must first identify it. Symptoms of the illness begin to appear during this phase. If a second response is required, memory cells are then released to recall this pathogen. Antibody formation by the immune system will therefore require less time. Re-exposure to the same virus triggers a secondary immune response that produces more antibodies more quickly and effectively than if an individual were to experience full primary exposure to the typical infection. Herd immunity is the theory that when a community is predominantly immune, a disease finds it difficult to spread since most of the people it comes into contact with are immune, hence preventing outbreaks and spread. This mechanism protects people against potentially fatal illnesses for which vaccinations may not be appropriate, such as immunocompromised adults or those that have severe sensitivities to vaccine ingredients. Living in an immunised community provides them with protection against the virus since it makes it more difficult for it to spread. A certain proportion of the population must be immunised against each disease for herd immunity to emerge. We can see this theory on the screen. Many factors influence vaccination uptake. Moral and ethical principles such as the obligation to protect life can influence decisions. Many people have recently expressed uncertainty about new vaccinations. There's a lack of trust that can be created and subsequently have a detrimental effect on vaccination uptake. The best defence against a variety of infectious diseases is to vaccinate. The most crucial thing we can do to shield our children and ourselves from illness is to vaccinate. Every year they avert millions of fatalities globally. Diseases like smallpox and polio formerly killed or crippled millions of people to have either disappeared or are now extremely uncommon in the UK since vaccinations were introduced. Since vaccinations were developed, the annual number of instances of some diseases such as measles and diphtheria have decreased to an extremely low level. The number of measles and mumps cases have increased recently due to vaccination reluctance. These illnesses can cause blindness, encephalitis, pneumonia, among other complications, highlighting the importance of vaccination. Childhood mortality is reduced by vaccination programs, which also make it possible for healthy children to attend school and as a result support their growth into healthy, productive adults. Furthermore, from fewer sick days and higher productivity, protection in adulthood contributes to economic growth. Additional advantages include reduced overall healthcare costs because the expense of treating illness and infection far outweighs that of vaccination campaigns. Increased life expectancy due to immunisations such as the annual flu vaccine and cancer prevention, with estimates indicating that more deaths from HPV infection could be prevented from any other vaccine. This concludes my presentation. Thank you for listening. Any questions, please ask.